I think, to be honest, the biggest opportunity for healthcare convergence is the smartphone that we carry in our pockets. I mean, it's fairly obvious, and it's been underutilized so far. But these things have the capacity to recognize melanomas and grade melanomas, and there are apps that have been able to be used to actually do that and be regulated. It also has the potential to be an actual therapeutic, so you can have AI agents and intelligent clinicians talking to you over that to actually solve those problems. It can also be used as a decision aid. So there are many different potential different technologies, both consumer and more clinical, that can be integrated and brought together through the smartphone. So I think it's a huge opportunity for convergence. Also, actually, the ability of the smartphone to link to other devices in the IoT space is another brilliant opportunity, so long as, of course, the batteries can live up. I think the really interesting thing is that we're seeing drug companies wanting to be service companies, and we're seeing service companies wanting to be drug companies. And that's fascinating. Again, it brings back the issues around the interesting convergent activities that are happening here. So for example, if you look at Sanofi invested alongside Google Verily into around 500 million in total to create an entire new service model around diabetes management. Now that's a service, it's not a drug. And that's the first time actually a company like that has done what it's done. And that's fascinating. But equally, on the other side, I keep kind of running into clinicians and hospital institutes who are looking at how they can utilize their data and the insights around that data in order to develop drugs. And so I think this is a fascinating thing that's going on around personalizing healthcare. The single biggest problem is that we have a multiplicity of technologies out there. Today we have analytics, we have therapeutics, drugs, which can knock out liver proteins and change the way that our body responds to different signals. We have artificial intelligence bots that can talk to you much more like a human being can and maintain these conversations. Many, many different types of technologies. The problem is that when you go into a hospital, these are never integrated in a way that they actually solve a problem for the patient. And that's the biggest challenge. So what Excite Ventures is really about is about, in fact, investing in the clinical process and creating licensable programs that bring together and integrate technologies for human benefit. And I think that's really powerful, because by doing that, we can, for example, prevent near-term heart attacks. We can predict them, and then we can prevent them, and we can scale that model. We can also actually have a big impact on exacerbations for severe asthmatics, another issue which actually plagues the clinical space. And many issues that can be tackled in that way, which product by product, silo by silo, really never become possible, even though we think they are. I came across a couple of very exciting companies. I think the first one was a sort of diagnostic testing technology, which you could put multiple kind of cancer drugs in and patient samples, and basically it would allow you to kind of test combinations of cancer treatments together before you ever put them into the patient. And I think that's really interesting, because we've learned that just as I've been talking about solutions, you have to integrate not only multiple technology types, you have to integrate multiple drugs to be able to tackle a cancer effectively. So I think that's really interesting. The other one I thought, which was really fascinating, was a company which actually has the potential to find breast cancer earlier, and through a much less sort of invasive and less radiation creating technology. And if, of course, that's true, and economically you can actually find breast cancer patients earlier, then in integrated solutions we can start to actually prevent breast cancer ever becoming a problem. And I think that's really exciting.